For years, some organizations have been sounding the alarm about a growing epidemic, serious mental health issues suffered by some first responders. The CDC found work stress in first responders can be associated with elevated risks for suicide, anxiety, depression, and other issues. As CBS 2's Alice Gaynor reports, local law enforcement agencies are now renewing their efforts to highlight mental health resources available to officers.
Cops deal with significant traumatic events. You don't realize how it affects you until a lot of times it's too late.
It was almost too late for Brian Weitzman, a former sergeant with the Passaic County Sheriff's Office for more than 17 years.
I'd be in morning lineup asking everyone, is everyone okay?
As for himself,
I didn't know who to go to. I didn't know who to talk to. I was at my weakest point in my life. The hardest part is just trying to keep yourself in one piece, and it's the one thing that people don't want to talk about. It's a stigma. You talk, you get the rubber gun squad.
We pride ourselves when we lower crime. We pride ourselves when we lower car thefts, but we just can't seem to get a handle or understand why these decisions of suicide are being made.
The New Jersey State PBA president says in 2018, 16 of its members died by suicide, 7 in 2019, 8 in both 2020 and 2021, 17 in 2022, and 12 in 2023.
The pressures from the public and the pressures from our agencies sometimes become too much.
Today, law enforcement have many stresses. The battle on the war on drugs, the battle on terrorism and crime. But we are under such a focus that it's creating so much stress.
In a job that when I started was you're a very well-respected person. People wanted to talk to cops. They wanted to be your friend. Now it's the opposite. People forget we're human. Cops are human beings that have a life. They have children. They have marriages. They have relationships. They have loss.
According to a study published by the National Institutes of Health, it found law enforcement personnel are 54% more likely to die by suicide than people with other occupations, citing exposures like witnessing death, violence, abused children, and human misery. Weitzman says he finally sought help. His only regret is that he didn't do it sooner. He now speaks to current law enforcement officers about his experience. His message: you are not alone. Talk to someone.
Just that one phone call for an hour weekly makes a huge difference, because you're able to tell someone that this is what I have going on, and they're able to give you a real answer how to deal with it.
There are many nonprofits, including the foundation, that has a network of psychologists and psychiatrists who would be more than willing to help.
At the state PBA, we have 7, 8 therapists on call. We have a full-time psychologist.
Weitzman, who also taught criminal justice at a local university, says he would always tell his students,
when you identify as a man or a woman or a person as a human first and as a cop second, your life will be better.
Weitzman says sometimes it's easier to talk with a fellow or former officer who can really relate to things you've seen. Cop to Cop is a 24-hour peer support network. We've put a list of resources on our website, cbsnewyork.com.